Hi everyone, I'm Dr. Karam. I'm a board-certified facial plastic surgeon and a facial rejuvenation specialist. I want to talk a little bit about the concept of preventing structural facial aging, and specifically about a procedure that I perform called the Vertical Prevent. But before we go into it, let's take a second, if you don't mind, to subscribe to our channel. And remember that afterwards, if you like what you hear, please take a moment to like and comment and forward it along to any friends or family that might find this information helpful. We want to get this in front of as many people as possible. Alrighty, so let's talk a little bit about the concept of facial aging. So I've spoken a lot of different videos on what happens, but I'm going to summarize very briefly. There's three basic components of facial aging. There's aging of the skin, there's loss of facial fat, and there is this concept of laxity happening over a period of time, which causes the fascia to elongate. So the facial soft tissue components get longer over time. What are those facial soft tissue components? In a nutshell, upper eyelids, lower eyelids, the skin becomes elongated, the upper lip becomes elongated, and then on the outer sections of the face, you see a settling of the lateral brow as the fascia becomes elongated, mid-face starts to move down towards the mouth, jowls start to form, and the neck becomes heavy and loose. So we know those are all the changes that are happening specifically in the category of facial laxity and soft tissue sagging. But what can we do to prevent that from happening? So here's the most simple way to understand this. With the skin, there's some things you can do, and we talked about this on some other videos, that you can do to prevent skin from aging and keeping it looking young literally forever, as long as you do the right things. Facial fat loss, not much you can do. It's going to happen. It starts typically in the late 30s and then progresses on. The only way to manage it is to replace it at whatever point you want to restore that volume and maintain the overall look. Soft tissue laxity, same thing as facial fat loss. Starting at different points in time, everyone has a different sort of trigger of aging. But if you take an average, most women and men start to see the changes affecting their facial soft tissue happening somewhere in their late 40s, early 50s. This is the point where you wake up one day and you're like, wait a minute, I see things on my face that I didn't see before. And once it starts happening, it happens pretty rapidly. And usually it's a observation that suddenly there's a little softening of the jawline, or there's a little bit of looseness under the chin. And then what happens is during a very short period of time afterwards, all those changes become accelerated. So when you fast forward 2 or 3 years, it suddenly looks like you have aged more than 10 years. Whereas your entire life, you basically look like the same person. You didn't change at all. But all of a sudden, once aging starts, it's like year after year after year in a very short period of time, you're seeing yourself rapidly change from that look that you had when you're younger. And that is the number one thing that drives people crazy, right? At the end of the day, we feel very young on the inside. Our mental image of ourselves doesn't change. We're still that face that we've always known of ourselves, and usually that's somewhere around our 20 and 30 year range. But yet when we get photos taken of ourselves or see ourselves in the mirror, we're like, yeah, that person who is that person? It doesn't jive with who I expect to see. And that's where people start looking for treatment options. That's where they start going into their medical spas, they start seeing plastic surgeons, they see their dermatologists. They're trying to figure out how they can address these things. Now, it's a confusing topic, and I know there is a lot of opposing views on this, but I'm going to try to make it super simple so that you can guide yourself in the process. So basically, it comes down to this. And this is almost like an absolute. When it comes to facial laxity, the only thing you can do is reposition the soft tissues back to where they were. If you wait till they've fully aged, then you're looking at restoration. If you address them early in the aging process, you're approaching things in a more proactive way, sort of in a preventative way. So what I did in my practice is I developed 2 different pathways for patients. Those patients who are younger, say in their early 40s or mid 40s, or sometimes even in their late 30s if they have premature aging that happens, but they're showing signs of laxity, but it hasn't become fully manifest. It's not terrible looking. It's not heavy. It's not completely changing. But the person wants to get in front of it. The typical approach for most patients, they think, is I need to do something non-surgical. I need to go get fillers, I need to go get some lasers, I need to go get something like that. And what happens is that patient ends up spending tons of money over time, year after year after year, and they still do not see any impact in their jawline or their neck or whatever. And in fact, it continues to accelerate over time. So what this whole video is about is how to stop that from happening if indeed you want to take a more proactive approach. So the vertical prevent procedure is the procedure where it reshapes the face back to that youthful look, even if it's early in the process. It typically is ideal for people who don't have a lot of laxity in the neck. If they have a lot of laxity in the neck, we do something more along the lines of a restore. But if their laxity is early in the process, what we want to do is get in there, support the soft tissues by releasing the facial ligaments, repositioning everything back to where it was. And by those maneuvers, the face is now stable over time. So year after year, instead of watching yourself really accelerate, you're pretty much looking like the same person all the way through. And that's an amazing achievement if you think about it, because throughout most of our lives, we always thought somebody had to look really old before they had a surgical procedure done. Now we're flipping the paradigm and saying, no, we want to address things early if we have the opportunity to keep the person from ever looking old. Think about that for a second. If you had the opportunity to never see your face as an older person, that would be pretty awesome, right? That would be pretty amazing. That's a pretty advanced way of addressing these things. But that requires an efficient approach before things get too far along. Now, if they get far along, we can always bring it back, but there's a lot of good years in between them. And that's the rationale for more of a proactive or preventative approach is if it's starting to bother you today, address it earlier so you can enjoy your youthful face for as long as possible, as opposed to having this top of mind issue with aging and then suddenly at some point 5 years, 10 years down the road, then you find a solution for it. That's a lot of mental energy and thought going into something that could be avoided altogether by early intervention. So that's the basic premise. Now, what happens with patients who undergo these procedures, and when you look at the before and afters, they're not dramatic. They're not these jaw-dropping, images that they're not like hero type of outcomes, right? But that's the whole idea. You as an individual would rather not be the before photo and some of those dramatic changes, because the more aged you are, the bigger the gap is going to be from the after. But also socially, people will see that there's a notable difference in your face before and after, right? But if you do things early, you're just going to basically keep yourself in this realm of technically never aging and keep everyone guessing, why are you looking so young yet you're in your 50s or your 60s and yet you look like the same person. And we've seen this over and over again where we have patients who are in their 70s and they literally look like they're in their 40s because through their 40s and 50s and beyond, they've done little surgical tweaks at these different points, and it's had a massive ability to maintain that youthful look over time. So that's that rationale. It's so that you don't have a big dramatic before and after change. You are able to preserve your youthful look for as long as possible, and ultimately keep yourself looking as young as you feel without ever seeing the older version of yourself. That's the preventative paradigm that has really become much more popular in our practice. We have patients that are probably younger than they ever have been, but with the appropriate facial changes that justify the procedure, they're just doing it a little bit sooner than traditional times when we see patients much older. So I think it's a very, very good direction that we're going in with this. Societally, it's becoming a lot more acceptable, and as a result, I think patients are going to be a lot happier with it as well. So if you have any questions about this, please feel free to visit my website, my Instagram. There's tons of patient testimonials and examples of this, but also comment and ask some questions in our YouTube here. We'll get to them, as well as send this along to friends and family, and let's get a conversation going and help spread the word. Don't forget to subscribe. Thanks so much for your time. Dr. Karam.